Welcome back to the program. How do you help someone with mental illness who refuses treatment? That is the very beginning description of a conversation that we're about to have that I'm very pleased about. We are addressing these kinds of issues in ever more formal ways in our society, and certainly it is a pleasure to be here in Summit County and in Park City, where it seems as though in many ways we are leading in our maturity in addressing these very difficult, fraught with emotion topics. And this evening I am pleased to talk about the upcoming LEAP course with the good folks from Connect Summit County. This is Dr. Melissa Lopez Larson, Mary Closser, and our very own patient advocate from Park City Television, Kim Crittenden. Good evening, ladies. Lovely to have you here. Thank you for coming.
Thank you.
Doctor, if you would lead us off in the conversation and talk a little bit about the background and the design of LEAP and about the situation, that the opportunity that we find ourselves in by taking on these topics in an organized manner.
Well, LEAP is a program that's been designed to help with medication or actually treatment compliance. And basically that means is whether people are adhering to the advice that their therapists, their physicians, and their basic providers are asking them to do. You know, people struggling with mental and medical issues oftentimes are not compliant with treatment. And you know, there's estimates that up to 30 to 50% of people are actually either somewhat compliant or have zero compliance with their actual treatment. So this is a big area of concern, and particularly for mental health issues. Some of the risks associated with relapse or from not using their medications include relapse of their symptomatology. And that can really wreak havoc on your brain chemistry long term, and turn a once manageable illness into a chronic illness that has a very poor long-term prognosis. And so, you know, these types of programs are just really important to family members, to other community members, providers, you know, in ways that we really have to help our individuals who are struggling with mental health really get the treatment that they need. One of the main factors that contributes to noncompliance with treatment is really a lack of awareness of actually having a mental health issue. And because that's such a problem, why would they seek treatment? Why would they take these medications? Why do they need therapy if they don't even recognize that they have an issue? And so I think LEAP is a unique program that really addresses one of the core reasons for noncompliance. There's a lot of other reasons for noncompliance with treatment, such as side effects, costs, you know, other things like poor follow-up, you know, stigma of just being on medications in general. So there's a lot of other reasons for people to not want to take their medications or not want to engage in treatment. But for sure, one of the biggest issues is just this lack of awareness of having any issues at all. And so the other things that I like to talk about is just, you know, some of the long-term problems associated with not being compliant with medications. As I said before, you can worsen the prognosis of your illness. It's often associated with a lot of ER visits, hospitalizations, and one of the big issues is loss of support long-term. You know, you really mental illness takes its toll not just on the individual, but on the family. And so a lot of times people will start losing connections to family and friends, and they just lose that social support that they so need when they're really struggling with issues. So.
And then becomes a time where the crisis becomes really full-blown.
Exactly, exactly. So.
Mary, if you would talk about your involvement with Connect and with the upcoming LEAP course training.
Okay, you bet. I joined Connect as a board member almost a year ago, because I have a personal experience with my 19-year-old son who has been diagnosed with bipolar, and it's been a challenge on our family. So I'm very excited about the upcoming training in the middle of November 15th, 16th, and 17th, I believe. And it's a 3-day training, and so I will go to the general training on LEAP, which stands for Listen, Empathize, Agree, and Partner. So it's a way of talking to the patient or the child, whoever it is, friend. So you learn how to talk to them in the same way that a therapist, you know, teaches people to talk to each other in relationships. Thursday is a general training for everybody, And then Friday and Saturday are specific trainings. Friday is more for therapists, professionals, and criminal police department. And then Saturday is a training for people like me, friends and family and peers. So I'm really excited because I need it. I need help. The people who are working closely with my son, we all need it. So, and it's pretty common out there, this mental illness, way more than we know. I just met someone today who had all 3 of her children have been diagnosed with bipolar.
Wow.
Can you imagine? Yeah, so I think it's necessary.
Indeed.
Yeah.
Kim, of course, you and I know one another
Hi,
for a number of years, so I know you
yes.
as a seasoned caregiver. Talk about your involvement with the organization and your passion for this formal education process.
So I am unbelievably happy that they are coming to provide this training. So my personal experience is my brother received a diagnosis of bipolar disorder when he was 25. And we, in retrospect, figured that he probably was suffering from the time he was about 16 or 17.
Wow.
And that did not have a good outcome. So when my own son was diagnosed with bipolar disorder, I was terrified because my life experience with that diagnosis was anything but positive. It was tumultuous, it was tragic, and so I was just absolutely at my depths of despair when I came across Connect, and I actually went to one of their trainings, and they had a person that knew about bipolar disorder in adolescence, and actually he was an expert about bipolar in adolescence with ADHD, which my son also has. And so I went to that training, and all of a sudden it was like, "La, there is hope," and I started to rethink that. We got the diagnosis much earlier, and so with the good advocacy that my son has with our family, I all of a sudden I had hope instead of that just feeling of distraught and despair in my heart. It was like, okay, we can do this. And so I was thrilled when LEAP came around because for my son, medication compliance was the #1 issue. And that's been from day one, even with his ADHD. ADHD wasn't a problem for him. It was a problem for everybody else.
Right.
So why did he need to be medicated? And so we would find meds stashed, we would find them hidden, we would find things. And when Max was finally diagnosed with bipolar disorder, we had to have law enforcement intervention to come and help him realize that things were not okay,
Right.
and they could not continue the way they were. And he would take his medication sporadically. He would take it until he felt fine, which I think is kind of normal. Okay, I feel good, so I'm done.
Right.
And then he wouldn't take it, and at least for bipolar disorder, it feels kind of good when you're headed on the upswing. So why would I take it then? So we kind of went back and forth with this. We've been inpatient a couple of times, but we actually found a 30-day injectable that has taken care of that. But that was a lot of intervention, and luckily he and I have a really good communication, and so we had a lot of discourse. And once he finally realized that medication was his best option, and it wasn't me telling him he was sick, because there was a lot of the diagnosis. I don't want to talk about my diagnosis. Like,
Sure.
oh my gosh, that was just the worst.
And it really requires an entire
It
grouping
does.
of
So
people.
I'm hoping that other families will not have to go through the months and months that I had to
Sure.
kind of gain this experience and have a good communication strategy, because I didn't have a good communication strategy, which I think
Sure.
was part of it.
Sure.
You can't bully someone into taking medication.
Definitely not an effective communication
No,
strategy.
no.
Ladies, let's take a quick break. We'll come back and I want to talk not only about the specifics of this training, but also where we're headed in the decades to come.
Sounds good.
More with Connect Summit County on their upcoming LEAP training. Stay tuned. We'll return. Welcome back. We are discussing the upcoming LEAP course training put on by Connect Summit County, and more information about ways in which you can interact with this important education as a caregiver for those who are suffering from mental illness. Dr. Lopez Larson, if you would talk a little, and actually both you and Mary, talk a little bit about Connect's role in this subject and what your long-term expectations are. This is a great event. I'm sure that it's just the cornerstone of many more to come.
So I'll let you start.
Well, Connect was formed almost 2 years ago, and our main intent is to reduce stigma of mental illness. And it's going forward, you know, we want to offer resources for everybody, many different kinds of mental illness, you know, depression and bipolar and schizophrenia, but every kind, going into aging and dementia, and we want to try to cover all topics for people to be able to come to our website and not know where to start. I know when I was hit with this almost 4 years ago, I had no idea about the world of mental illness. I no experience whatsoever in my background. So it was all new, and I was devastated, I was embarrassed, I wanted to hide, and I know that everybody must feel that way. They don't know where to go. So we want to reduce that stigma and let people know that they're not alone. And there's plenty of us out here, right?
Yeah, there are.
So this is one characteristic of it. This is Dr. Amador, who is going to be doing this training on November 15th, 16th, and 17th, and will be helping people learn how to talk to people. And it's not, you know, it's great for people who have this disease, which is called anosognosia, but which is where you are unaware of your illness. But it's also great just for, you know, personal relationships too.
Absolutely.
So Connect is, I think we've been very well received in the community because we do need to reduce the stigma. You know, it's not a closet thing anymore. You know, it's more out there than we know about. You want to add to that?
Yeah, well, and I think, you know, we asked the question about what's the future. I think the future is trying to find some of these amazing programs and different techniques to improve how we treat people with serious mental illness. And, you know, I think there's been a lot of research about medications, and I think we have a lot of different options in that regard, but we're still struggling with how to make sure that people are actually getting the treatment that they need. And so investing more time into some of these great programs and getting it out to the communities, whether it be law enforcement, schools, parents, you know, everybody needs to really know how to address some of this really core issue that seems to be neglected and is so important in patient outcomes and things like that. So.
And where should folks go to find out more information, both about your organization and also about the upcoming LEAP course?
Yeah.
They can go to connectsummitcounty.org. That is our website.
Excellent.
Yeah.
Thank you all for sharing. Thank you for the commitment that you have made to this so important education within our communities. Kim, thank you so much. Mary, likewise, for all that you do. Dr. Maria, we appreciate you. Nice to see you all, and best wishes for a lovely course, and I'm sure that we'll see you again soon.
All right.
Okay, thank you.
Terry.
Connect Summit County. Make sure to find out if you are a caregiver or certainly are someone within a universe of providing care to those who may not be aware or ready to deal with their own mental illness. Make sure to include the LEAP course training in your education. We'll be right back after this.